Welcome. We're expecting a few more people, but we're going to respect everyone's time and go ahead and get started. And we're recording the session to be able to share it with folks later. I'm Jen Brown. I'm the co-director of ARC, the Alliance for Research in Chicagoland Communities at Northwestern University, and so glad to be here with my colleagues. All of you are here, all of us are here because we want research to have an impact. We want research to have an impact on people's lives. And to have an impact on people's lives, health research must reach patients, communities, policymakers that are impacted by the research findings and can make decisions based on the findings. How does it reach them? Not through the academic echo chamber of peer-reviewed journal publications or international research conferences. We learned a lot through the initial work that you're going to hear about in a minute, about that if researchers do disseminate their findings outside of academia to media, it's more often to mainstream traditional media and not community media that are most represented and connected with communities impacted by health inequities. Researchers told us that they don't know much about or have much connections with or training in community media here in Chicagoland or otherwise. We also heard from communication staff at many local medical and other health professional schools that they don't have connections with or an understanding of local community media. So here we are. These conversations have led to today's session presented by Public Narrative, the Alliance for Research in Chicagoland Communities at Northwestern, and the Chicago Consortium for Community Engagement. This has led us to the absolutely stellar lineup of local community media journalists and outlets that you see on the screen right now. It's my pleasure to introduce Jhmira Alexander, Executive Director of Public Narrative, Yazmin Dominguez, Coordinator of the Chicago Independent Media Alliance, Jesús del Toro, Editor-in-Chief of La Raza, Maudlyne columnist with the Chicago Sun-Times, and Jackie Serrato, Editor-in-Chief of the Southside Weekly. We're so excited to have this conversation with you. As I mentioned, this session today is convened through Public Narrative and the Alliance for Research in Chicagoland Communities. Next slide. The Alliance for Research in Chicagoland Communities, we were started in 2008, and we focus on catalyzing and supporting research partnerships that honor, are driven by, and share power with communities to improve in health and equity. Here's our website. And this is a topic that our community stakeholders and our research stakeholders have been raising since the get-go, and I'm been so glad to work with Jhmira and others on it. I'll pass it over to Jhmira to share.
Thank you, Jen. As Jen shared, I'm Jhmira Alexander, the President and Executive Director of Public Narrative. We've been around for just over 33 years now, doing great work in connecting community members with journalists, and very fortunate to work with the journalists that are joined with us today. They've been part of many public narrative sessions, accepted pitches from different organizations and such, and have a lot of insight to what we're going to talk about today, particularly our Chicago Community Media and Research Partnership. Very honored to have worked with Jen Brown and her team, Dr. Rebecca Johnson, our Director of Media Engagement, Marie Valendo, but of course, these fabulous journalists that we have here to talk more about our project. So we started in September of 2019 on this project, long before the days of COVID, had no idea what we were entering into. And the Chicago Community Media and Research Partnership, established as a partnership of community stakeholders, community media, and community engaged health researchers, working to explore how community media outlets can effectively share health research with communities and populations experiencing health disparities in order to improve their health decision-making. And I want to take the time to learn a little bit from the journalists and you all and your experiences on this project, and even within what you've seen as far as health coverage is concerned in Chicagoland communities. What were your impressions of the 2 years of us on this project together? And let's start with Maudlyne.
Thank you, Jhmira. I have to say that the 2-year journey with the Chicago Community Media and Research Partnership was one of the most insightful endeavors that I've had in recent years. I started out not really understanding the relationship between health research and journalists. Before we got into the process, the only relationship we had was that we would get, for me, I would receive press releases or emails from health researchers and typically ignore them because they were usually in jargonese or irrelevant to the communities that I covered, which is the Black and Brown community, or really was so high over my head that I could not bring it down to really be able to tell my audience and those people that they sought to impact, how this impacted their lives and how they could use this information to live better lives. And so that was where I started. And over the course of 2 years, I learned so much about how critical it is that researchers and journalists work together and be able to understand one another in order to get this critical information that's consistently coming out to the audiences that they seek to help. Without that symbiotic relationship, that information goes into a black hole. So that's what I learned from this, and it was really beyond eye-opening.
Thank you, Maudlyne. Welcome, Jackie. Yazmin, you want to weigh in? Your impressions of the project?
Of course. Well, to start off, I think the fact that the Chicago Community Media and Research Partnership created a space to bring these very different groups together to begin having these core conversations is a good first step in the right direction to get us where we all want to be. So the fact that there is a general space we're all in the same virtual room together, I think is really great. And being a part of the first phase of the partnership, you know, being in media for a few years, I don't necessarily, I kind of transitioned out of being a journalist to being more of a coordinator for a media alliance. But it was very still eye-opening for me to hear firsthand from the journalists how they take and perceive like health pitches and what to do, what not to do. And we had this conversation about, like 6-8 months ago. It's been a while now, but some of those points I still think about in my head, and I'm looking forward to kind of sharing some of that take later on.
Yeah, awesome. Thank you, Yazmin. Jesús, how about you?
Thank you. Thank you for the opportunity to be here. And yes, as Maudlyne said, for me, this has been an experience of learning and discovery, because in the past, we usually interact with researchers and health professionals through press releases, sometimes with some direct interviews, but we didn't really understand the process they use in order to, of course, obtain the results of the research and then to disseminate or to try to disseminate that. And also they didn't know how we consider or not some research to be covered or to write a story about it, because they didn't know, for example, what are the timing, the priorities, or the focus that journalists, specifically from a community media like us are looking for in a story that we need to share. And these 2 years have been a lot of learning for me, and I hope somebody can say in coming years that this is going to be very fruitful, because we are going to enhance a lot the communication. This could be a big bridge for us to cross into the researchers' land and vice versa, and that is something that is also very important, because we think this needs to be beyond these 2 years and to provide more at the end information that is going to save lives, is going to, protect the health of our communities, and also to do good for both the journalists and the researchers, professionals.
Yeah, totally. Thank you, Jesus. Jackie, your impressions of the project?
Oh, well, I really enjoyed being part of this cohort of community journalists. I think COVID really exposed how much lack of health-related information is publicly available. And I think we also saw the rise of disinformation in the last couple of years. So I think as community media, sometimes we have, limited resources. That's just the truth. And that means that many times, we also have limited access to the experts. And sometimes that connection between the experts and the journalists is non-existent. Unless we have a reporter that is focusing on the health beat, and unless we have the funding and the resources to assign them stories about public health issues, those type of stories are really hard to come by. So I think this is a good step, as somebody said, in the right direction, because we are grappling with multiple public health issues, right? COVID was just one of them, but I think also gun violence is a public health issue. And there are others that as Chicagoans, we have to grapple with. So I appreciate public narrative being the mediator of these conversations.
Totally. Thank you. Thank you. I got to tell you, you all are going to hear quite a bit as we talk throughout the afternoon about community media and just exploring what community media is. And throughout our partnership, we've used that term community media to refer to community or independent media outlets that serve specific community areas or regional African American, Latinx, Asian, Arab, my apologies, Native American, LGBTQ, or immigrant populations. And in utilizing that term and really understanding that term, I think it took a lot of foresight for researchers to even approach public narrative and the community media journalists to understand where exactly we needed to explore in connecting the community with research through community media. So, much gratitude to Jen Brown and her team for the foresight in that. When we think about community media outlets and journalists, in exploring this project, we identified that invaluable resource with unique connection to specific populations or local communities often have interest and capacity to tell more in-depth stories, resources that will support their engagement with health research, connections with relevant health sources, health researchers, health providers, patients, or survivors, fiscal resources to hire health reporters or pay freelancers for health stories, and to pay health reporting and training opportunities through fellowships or residencies. Have any of you, and forgive me if this is a spur of the moment question for you, but have any of you experienced, any type of capacity building within your outlets as a result of this project, or has it kind of opened up your brain trust in thinking about where you might take your own reporting after learning what you did in this project?
I'll just say that for me, it most certainly opened up my horizons in terms of the type of stories that I was missing and the type of stories that I needed to add to my repertoire, and how to make those stories newsworthy, how to make those stories engaging, how to make those stories, how to help those stories reach the communities they were intended to reach. So I now pay attention to those press releases from the various academic institutions and the government agencies on ongoing research. And I'm always keeping an eye out for, okay, is this one that I should hone in on and reach out to them and ask for help bringing this down to ground level for my readers?
Sure. Others?
Yes, and I can say that thanks in a big part to this initiative. When we last year decided to run a COVID-19 vaccination awareness campaign in Spanish, La Raza placed some billboards, ads in bus stations, in trains and CTA buses to promote the vaccination and to try to help to reduce the disparities that our community is still facing in health terms, but in this specific aspect of COVID. I must say I apply a lot of what we discussed during this the conversation of this group, of this initiative, and I can say that helped a lot to make this campaign that we did more effective, with more focus, because we understood better how to you know, how to showcase health content in a way that is useful for our community, and of course to manage it with our limited resources in the best way possible. Then that was a specific, good result of this project. And in general, as everybody is mentioning, I think we now have more open eyes and hearts and ears to the content, the information that is coming from health researchers and health institutions. As Jackie said, COVID showed us that we were very unprepared, and now we are trying to, cover that gap. And this initiative for us has been very important, and hopefully it will provide also, learning and elements for others too.
Sure, sure.
I think I also learned that health researchers are very well intentioned, but maybe sometimes they're not trained to think about how to, how to spread the word, how to, distribute their research and the information that they've found. So I think having, conversations with those researchers is important, just so that they're aware that we are here, that we're available, and that we're interested in diffusing, their research. Also at the weekly, we started leaning more into quantifying inequality. So, during COVID, we did multiple mapping projects where we were able to map out, what neighborhoods were seeing the most cases of COVID, which neighborhoods had the most deaths by COVID, unfortunately. But then also when the city began to distribute vaccines, we started to map out where those vaccines were going. And as you all know, when you see a map of Chicago, you see that, the South Side lacks many things, lacks investment. But then we also notice that there's just a lack of pharmacies in the South Side. There's a lack of clinics in the South Side and hospitals. So, a lot of things that were always under the surface just became very evident.
Sure, sure. Yazmin, did you have anything to add before we move on?
Well, I just want to say too that I think as a result of the pandemic, like I agree with Jesus, I think media realized how unprepared we were for this kind of situation. But as a result, I know since my background is more in media collaboration, and Jesus, you were part of this group too, the Solving for Chicago was created. And Solving for Chicago was a group of about 20 outlets, majority of those being in SEMA, that reported specifically on essential workers, did an essential worker series during the pandemic. And I think that just goes to show community media, although we're small, we're mighty, and we're able to collaborate on certain topics, and in turn produce the various health-based stories in various outlets at the same time. So
now we have a question in the chat, and Janice wants to know, is there a such thing as fellowships or internships for health providers and media in the Chicagoland area?
I will say that I don't know of any. I think that in general, that the media is typically open to any entity that wishes to engage with their newsrooms, and thus a Northwestern or University of Chicago or any others in the medical institutions, medical and research institutions in the Chicago area could reach out to a Chicago Sun-Times, for instance, my outlet, and say, hey, we'd like to have 2 or 3 of our researchers come and meet with your reporters and just, talk to you about the work we do, or the work, or how we can work together, or learn more about the work that you do. So there are those informal type relationships, and they occur all the time, but there typically isn't that sort of a fellowship or internship for medical providers or researchers within the newsroom. They're considered the sources, the instigators of news, and so therefore there's kind of a wall there.
Yeah.
Yeah, and I think that one of the conclusions of the work that we did during these 2 years is that we identify the need of these kinds of initiatives, to have fellowships, to have internships, to allow both the researchers to be more knowledge about how media works by interacting directly with them, and on the other hand, also to allow the journalists to have resources to devote more time to report on health, and also to perfect their skills, or to increase the knowledge that journalists have in order to better cover the health issues. And in California, for example, there is the USC Fellowship for Health Reporters that is very important and provides resources to journalists to do that. And I believe Stanford University has a program that embed health researchers and physicians, as Maudlyne said, into outlets in order to grow the collaboration possibilities and the interactions. And of course, this is something that I think we will need to improve here, and to convince institutions and funders to support this kind of fellowships and internships.
And that's exactly where we are. As I shared, this project was 2 years long, but continuously, we checked in to identify what other possibilities might live beyond those 2 years, and have submitted applications for grant funding. So Jesús, you're absolutely correct. It does take some convincing of funders to buy into this concept. But we've thought through, how do we build capacity, and who do we invite to the table? How do we, extend this knowledge and this understanding? And there have been, some interest towards this project, but not to the extent that we envision it. And so just know that, we're definitely thinking far and large about how far this, the capacity building within this project can really, really take us. I want to take a step back and look at the perspectives from the community media journalists, because during our project, we had a series of focus groups, and one, of course, was with community journalists. And here were a few takeaways. One person said, connect your research to how people are living their lives. Don't just send us research for the sake of research. So being very direct and very specific about what you're sharing. Another said, I would like to know if it will have a direct positive impact on the audience that I write for. I want to know what they will gain from the research. And then another journalist said, community media organizations matter, and in some ways matter more than the big ones. You need to go where your people are, and community organizations do that. They are community first, so don't ignore us. And just hearing, some of the feedback from the conversations, the host of focus groups that we held, it was really interesting to understand everyone's perspective and allow for this project to be one that really synthesized the thoughts and ideas that everyone held. We came away with this beautiful framework that helped us understand, start to finish, what our project looked like. Everything from engaging community stakeholders to evaluating impact. And we'll talk a bit about, each step within the process, everything from community engagement to ongoing engagement with community media, assessing fit for community media, being able to translate the research findings, and making certain that the research information that is being shared is, of course, applicable to the respective audiences. So in step one included engaging community stakeholders, identifying, what communities or populations are impacted by the research focus, what community organizations or providers serve or represent these communities or populations, what agencies or policymakers make decisions that impact the focus, communities or populations. So understanding who those stakeholders were, that you would be engaging with in the research project. And then, of course, assessing research findings in identify audiences in step two. And so we're looking at what are the key research findings, our findings ready to share, our findings relevant to the communities or populations identified in step one. In step three, translating research findings to actionable information. So our findings actionable by audiences identified in step two. What translation can be done to make findings more actionable? And is the information accessible to audiences? In step three, assessing the fit with community media. So where do audiences Identified in step 2, get trusted health information. Do more stakeholders need to be engaged to understand how audiences access community media and what can be added to increase newsworthiness for specific community media? Step 5, engaging community media. So what does our partnership know about community media? What resources would support our partnership to engage community media? Who should engage with community media? And all of these questions that are posed in navigating this framework allows you to identify what resources and what access you have within your own team, within the project that you're a part of. And then lastly, but certainly not least, step 6, evaluating impact. Was there any community media coverage, and what impact did coverage have on audiences? And that may be more of a long-term ongoing process in being able to evaluate. There are times, and the journalists can speak to this, there are times when a story may be pitched during 1 month, but you may not see coverage for quite a while. And it doesn't mean that the information that was shared was not valuable. It just could be the timing of when things are actually conveyed. So, in engaging with community media, there are a host of community media outlets who are all a part of the Chicago Independent Media Alliance. We'll, of course, start with the Chicago Reader. Yazmin, you want to share a little bit more about the Reader and the Chicago Independent Media Alliance?
Yeah, I'm glad to. So the Chicago Reader and SEMA. SEMA is the acronym for the Chicago Independent Media Alliance, and it started in 2019. I just want to make very clear that SEMA is a project of the Chicago Reader, and it's not its own withstanding organization. For the 60 people that are on this call listening in, we don't have like a specific website that you can go to, but because it is being built right now. So that will have our whole entire list of our 69 members. And let me take a step back and say that SEMA is made up of 69 community-based, independent, and local media outlets. And those 69 outlets represent 81 media entities, meaning, for example, like we have Chicago Citizen, who's one of our members. They have like four newspapers, which we consider products, and 1 podcast. So they have 5 other entities associated with their name. So that's what we mean when we say 69 outlets representing 81 media entities. Really, the Chicago Independent Media Alliance was created by the co-publishers of the Chicago Reader, those being Karen Hawkins and Tracy Bain. And the reason the alliance was created was really a direct result of the decline in advertising revenue for smaller outlets. The decline in advertising revenue led to a lot of media closings. One example that I always mention because of the timing, when the Chicago Independent Media Alliance was launched, OI, which was a big Spanish-speaking publication produced by the Tribune, was shut down between the same month, and that was due to a decline in revenue. So that is as a result of why we were created. We found that through collaboration, we were able to bring in more revenue and more funding and be more attractive to be funded by foundations. We really believe in the collaboration in order to create a more self-sustaining revenue and media ecosystem. I could go. No, I could keep going, so I'll let you go. Okay, so yeah, we officially launched in February of 2020. So it's kind of funny because that was our first and only in-person meeting before the pandemic happened. And so, the pandemic brought on a huge onslaught of more financial issues and problems for local media, similar to a lot of other industries. So it only reinforced the need for this alliance because, as we have already mentioned, I always like to say, independent local media is small. And as Jackie mentioned, it's usually under-resourced and it's usually understaffed. And those staffers are very overworked because of the nature of the industry. So we found that through collaboration, there's a lot of editorial collaborations, but ours is very based on financial collaboration. And we're able to create fundraisers, media fundraisers, and various group buys that, add to the sustainability of these local outlets.
Yeah, thank you for that, Yazmin. I do remember that meeting. It was good seeing everyone who knew that we'd be quarantined for as long as we were. But thank you for that. We're going to share this deck at the end of the workshop along with some additional resources. So you'll have access to this list in addition to a few other links and websites and things to check out. Jesus, you want to share more about La Raza?
Yes, thank you. Well, La Raza is a Spanish newspaper founded in 1970. Then we have almost 52 years of service here in the city. We are focused on the issues that affect the Latinx community. And because we are in Spanish, of course, we serve that specific segment of the population that doesn't have enough skills in English to interact with the rest of the society. And this is very important for us. And also, well, we have a lot of bilingual readers too that just love to read in Spanish, even if also they are proficient in English. But our main goal of La Raza has been always to put the community, the individuals and the organizations that serve and fight for the community in the first row of our coverage. Then in that sense, we are a community media because we cover what is happening with our community, with the people, and also because we are part of the community. No, because many media outlets can cover what is happening in one of our neighborhoods, and they do that. They do that. But we are, or we believe we are more capable to properly represent our community because we are culturally competent. We know what is within because we have been part of the community for more than half a century. And as many of our other partners and colleagues in the local media ecosystem, we have been suffering the effects of diminishing advertising revenues, for example, the impacts of COVID, and we are in a process of transformation too, in order to be able to keep going. We fortunately have had support from some foundations that are interested in preserving and enhancing this community media ecosystem that we have. And we are proud that we were named last year the best Spanish weekly in the US, the best weekly publication in Spanish in the whole country by the National Association of Hispanic Publication. And we published a book last year that was a compilation of the main stories about how our community faced COVID and other issues. And that book also won first prize in the International Latino Books Awards last year. Then these two things that are important, our daily work is the most important, but this recognition is important for us because we feel that our work is having good results, and we are keep going, and we want to keep interacting with our community as much as we can, as we have been doing through these 52 years.
Thank you, Jesus. Thank you, Jesus. And Yazmin, do you want to talk a little bit about Rebellious Magazine?
Yeah, Rebellious Magazine recently celebrated their 10-year anniversary earlier this month. It was founded by co-publisher Karen Hawkins of The Reader, and who also founded SEMA. So something else that I just thought of, a lot of people wear multiple hats in the media industry.
Yeah.
And Rebellious Magazine really delivers a unique feminist perspective on Chicago news, events, and politics, culture. They do a lot of original reporting, interviews, and I believe essays as well. So they're very, their angle is very, it's a feminist voice in Chicago.
Yeah, you mentioned that about journalists wearing multiple hats, and this next woman, I mean, she absolutely does. Oh, where'd it go? So, Jackie, you want to talk a little bit about Southside Weekly and your work with La Vaz?
For sure. Yeah, so Southside Weekly is a newspaper that is based in the South Side. It is very place-based. Our focus is, as I have already said, the South Side, and that's because traditionally the media has focused their coverage on the North Side and the downtown area, and the South Side has, I think, been an afterthought, more or less. So what's unique about our newsroom is that much of the coverage actually comes from volunteer writers. And we are constantly working with people who want to get their foot in the door, but they didn't necessarily go to journalism school, or they don't necessarily have the experience or the background to get like a staff position in a more well-known publication. But we also, question a lot of things, including just this notion of objectivity in the media, right? If you're familiar with the South Side, it's predominantly Black and Mexican with a significant Asian population and other pockets of immigrants. So I think what we understand as objectivity just simply does not align with the lived experience of residents in this part of town. So, we're really about working with people who represent the South Side and people who want to become a writer or become a media maker, right? And that includes not just journalists, but also artists, photographers, poets, creative writers, et cetera. And then at the Chicago Sun-Times, I helped to manage the Spanish translation for a new section that they started a couple of years ago called La Voz, which translates to the voice. And for the most part, we translate the content that is written by the English-speaking staff reporters at the Sun-Times. But we're also beginning to increase our original content. So also doing our own reporting that is originally in Spanish and then gets translated to English, because perspectives always also change, based on the language that is being used to conceive a story. So yeah, I think the goal of La Voz is to reach the growing Latinx community in Chicago. It's expanding. It is also bilingual, as Jesús mentioned earlier, but we have a significant Spanish-speaking population who do not have a lot of sources to go to. And yes, we're just providing another resource for them.
Awesome, Jackie, thank you. And I know that, the Chicago Sun-Times isn't considered a community media outlet. However, Maudlyne, you all do a lot of coverage and focus on community stories. We talk a little bit about that?
Sure. Without sounding too biased, the Chicago Sun-Times, of course, has always been the smaller, scrappy newspaper in town. So as such, the Sun-Times has also enjoyed the reputation of being the newspaper that covers more of the city, so to speak, in its diversity than our competitor. And so it has been a long history. And my column, the Chicago Chronicles, was established in 2016 as we saw the rise in citizen journalism. As we all know, in the mid 2010s, we saw a new phenomenon where anyone with a cell phone really could hang a shingle and call themselves a news reporter. And it also led to the whole debate over fake news and where you were getting your news, the sources of the news that you were seeing produced or plopped onto the internet. This really was also occurring at the same time that diverse communities were complaining about representation in the media, as Jackie so adequately pointed out. And so the Sun-Times decided that in response to that we needed to create a niche where we would focus on those communities and give voice to those communities that were complaining that they did not see themselves represented in the pages of newspapers or on television, except in crime stories. And that was the widespread complaint, that there was no positive news. There weren't diverse narratives of people, places, and things that make Black and Brown communities so vibrant, so critical, and so resilient. So
Yeah.
that's what my column does. And I look for those stories every day. But I'll just add that in addition, the Sun-Times in recent years has also enhanced that sort of coverage with programming, with funding, I should say, from philanthropy, such as the Chicago Community Trust and a National Reporter Fellowship Program, where we have several reporters in our newsroom who are specifically assigned to cover diverse communities, whether it be Pilsen, Little Village, or Chatham and Inglewood, and their assignment is specifically those communities. And so that has really also enhanced our coverage of those communities.
Yeah. Now, Maudlyne, not too long ago, you were the president of the Chicago Journalism Association, as well as the National Association of Black Journalists, the Chicago chapter. And I mean, we know a lot happens behind the scenes in really cultivating what we see published. What advancements did you see, you know, in the roles that you had with those organizations, or what do you see evolving or developing even to really like push health equity in Chicago and beyond?
Well, certainly as president of the National Association of Black Journalists Chicago chapter, our focus was equity in all its forms, in all arenas. And as health rose to the forefront in the past 2 years, you know, in 2020, just like many, we held our first board meeting of the year and, you know, had a plan for programming for the entire year. And all of it, you know, was just tossed into the garbage within 2 months by the pandemic. And so journalist organizations had to really rally to support our members. What we began to see was that, you know, our members were seeking training in ways to really enhance their coverage remotely. And so, you know, they were seeking training on data journalism as health rose to the forefront, visuals, video, et cetera, ways to enhance the quick, continuous news cycle of COVID reporting that we found ourselves in. And there was also, our members were, of course, complaining that, you know, the pandemic hit them hard, particularly our members at community newspapers and community digital outlets. You know, they did not have the resources that some of us, that an outlet like mine had, to withstand the sudden plummet in readership, street sales, and that sort of thing. So yeah, we saw both at NABJ Chicago and as president of the Chicago Journalists Association, we saw our members really having to pivot and become quickly up to speed on health issues and inequities, health inequities, this whole concept of health inequities. They didn't understand it. And now everyone had to learn it really quickly and learn how race played into health. And that was a real learning curve for many of our members.
Totally. Maudlyne, you said so much, and I want to get to some of the questions in the chat. Sarah Rittner wants to know, and I'm going to pose this to you first, Yazmin. She wants to know, do you know if there are any discussions within the media or communications outlets about offering community discounts, or perhaps having some kind of in-kind opportunities, particularly around advertising or publishing stories? You know, of course, with there being sponsored media, earned media, the distinguishing between the two, any pros and cons, but particularly the costs that are associated with those opportunities.
Yes. So I'm reading over the question right now. So the cost to publish in some media is very costly. Well, I know at SEMA, we are trying to build a Chicago media directory that we want to push advertisers to. So we are in the process of building it. It's currently being developed. Well, this directory, we wanted to have a lot of data points related to an outlet's market volume, market frequency, audience demographic, and then it will include a place for their media kits where it will have like an external link that if you click it, it'll take you to their rates of how much it costs to do advertising. We've been doing group buys at SEMA. So for example, if we have like one client, like the Department of Cultural Affairs and Special Events that the City of Chicago puts out. They usually reach out to us, SEMA, and I put my email in the chat, if they want to do multiple buys with multiple outlets. Instead of reaching out to various publishers, they just reach out to me, and I'm like the one person that deals with all the advertising managers, and then we get rates for them. So I know it's misleading because I know the question says to publish in some media outlets, but you know, I believe that would be sponsored or branded content that we're referring to here. And I do know that community outlets, well, the ones that I've at least worked with, that is a little bit of a newer advertising approach, like branded and sponsored content. But I do know that some outlets have started running those. Usually it's the traditional ads I've seen, but I will deflect to the other panelists if they have other takes with this question.
Let me just say that at the Chicago Sun-Times, we certainly do have nonprofit rates. So that if you are, you know, with a community organization, that sort of thing, we definitely have rates that are much lower and discounted for those sorts of you know, philanthropic organizations. So you can consider that. And then, of course, the other thing I will advise is that there are different rates depending on what day and what section you're looking for. And so you should always feel free to ask, you know, I'm looking for the least expensive option. You know, if there's a day or section that is less expensive, I'm interested in that.
Mhm.
I also want to add, Sarah, I just saw your comment here. WVON and WRLL. I would see, because at the Chicago Independent Media Alliance, we have a lot of members that are more like, I guess for lack of a better word, just like not on the level of WVN or like more smaller, have a more niche audience. And those rates will always be more inexpensive than the big name. So I guess what I'm trying to say is like expanding your binder of media is a good way to find more inexpensive rates for you to, you know, do 30-second radio spots. Like I keep using E3 Radio as an example. E3 Radio produces content related to LGBTQ community. So if you have any sort of like radio spot that you want to do that has any content related to that community, you can reach out to E3 Radio and have some sort of rates that are different. So that's just something I wanted to add as well.
All right, awesome.
Can I
Go
add
ahead.
something real quickly about that too? I mean, I think folks are bringing up that, you know, if an individual research project or an individual research partnership or an individual program is trying to, you know, make a, you know, purchase media cover or put an advertisement in, that's going to be harder than if there was like coordination across an entire institution, education institution, health institution, or, you know, collection of institutions. That's one thing. And then also thinking about, Yazmin, I don't know if you could speak to this. Like I know in New York, like if the health department or public agencies want to publicize, you know, participation in a certain program or COVID-19 testing information or something like that, they're required, they passed a law or something recently that requires them to spend a certain amount of that, you know, media buy budget in community media outlets, since it's known that that community media outlets are more likely to reach communities impacted by health inequities than some of the traditional outlets where they're often buying. So that's a kind of structural and systemic issue that may be difficult for an individual researcher to consider, but that institutions and public agencies or consortium could certainly think about how to address this at a bigger level.
Yeah, and Jen, that's a good point. So you're referencing it was called the Advertising Boost Initiative that was hosted by the Center of Community Media in New York. And I can drop all these links in the chat as I talk, but they are actually our main partner and our main founder. And we are trying to replicate that same model here in Chicago, but and I'll send a very extensive report that covers everything. We're finding it a lot harder to do that here in Chicago because first, New York had already had the support of their mayor to create that law, and so that's a little bit more difficult here because we'll have to advocate for it. I know SEMA hired a FOIA reporter to do research on the different departments of Chicago, including the health department, how much of their advertising funding goes to community media, and the results were pretty low. So we're trying to do phase 2 of that project, which will be getting someone to advocate for the city of Chicago to spend more money on local media as well. There's different nuances and difficulties as to why New York City had a much easier process than we do here. But part of it is because they had a lot of already support from the city of New York, and we don't here in Chicago. But I will stop talking for now and jump all the links.
You're fine, Yazmin. In fact, Nicole Diaz says at CDPH, they're currently trying to build their relationship with hyperlocal media outlets. So it sounds like that's another great place to start in seeing where you may find synergy.
And if I can add something related to that, thanks to that initiative that is now a law in New York City, almost half of the budget that the city agencies have to, disseminate their activities, their programs, goes to community media. And that have helped the community media there to, of course, survive these harsh times of COVID and the pandemic effects, but also to go beyond. And here in Chicago, we hope to do the same as Yazmin said. If researchers, institutions like our audience help to, to promote this kind of initiatives, join us in order to be able to present the case, we will be able, for example, to have more resources to publish more health information that our community needs. We will be able to translate more into the several languages that our communities speak, because of course we have the English and the Spanish, but we have a lot of other languages and communities that need information too. And I believe that the work that SEMA is doing in order to replicate what is happening now in New York City here is very important and is worth to be supported by as much constituencies as possible in order to make it true, to make it real. And at the end, that will help our communities because they will be better informed than we are now.
Totally. And I see folks are dropping tons of links in the chat. So certainly capture this information, but we'll share this deck along with a list of resources after the presentation. Were there any other questions for any of the journalists before we move forward? All right, awesome. So when we think about community academic research partnerships, for the Communities United in partnership with the Ann and Robert H. Lurie Children's Hospital and the Strengthening Chicago's Youth, that group out of Lurie's Children's Hospital, they hosted an event to really share the results of their research and really amplify the work that they're doing. And this is just an example of what that looks like. So they, of course, shared their pitch, and of course, this is health related, along with the full report to the study that they conducted. But then, of course, here are the results of that project. So when you get the deck, you can click the links to see the stories that were captured in Crane's Chicago Business, the stories that were captured with ABC, as well as the Chicago Crusaders. Journalists, do you have any tips or anything that you would particularly offer the audience for pitching you directly for any type of health stories?
Having members of the community available that us as reporters can speak to Obviously, we can do our own research and reach out to community members that, that we seek out ourselves. But I think if you're pitching us a story about an initiative that your organization is taking the lead on, you probably have better connections to those community members that are direct stakeholders of, whichever program or issue you're trying to promote. So being able to provide us with the contact information of those sources so that we can, call them up, follow up with them, vet the information that you provided. I think that would really speed up the process.
Thank you,
Yes,
Jen.
the human story behind the research and behind the findings is very important, because that will make the story, more understandable for our readers, but also will create, more interest in it among our community, and will allow us to decide, or to better decide what to cover, because sometimes we have limited resources and a lot of stories to tell, a lot of pitches that we receive, and unfortunately we need to choose, and sometimes we leave behind great stories, great findings, and if a story has many of what you are seeing in this chart, and has this human story, this human point of view, and also if it is, of course, very as much as possible connected with our communities, and has actionable elements, things that our community can do to improve directly their health, in this case, following the findings of the research, it will be very helpful for us, of course, to better do our job, and also to decide what to cover among a storm of elements that sometimes we receive.
And I would absolutely concur on all of that. All of these elements here are what came out of our 2 years of discussion and discourse on these issues, and what makes us either delete a press release without looking at it, or just scan a press release and delete it, or ignore a press release. And those things all come into play. If you want me in particular to pay attention to the press release, then the press release has to include all of these elements that we just talked about, which is, what's the human factor? Tell me how it relates or impacts the actual human being. Tell me why the reader should care, and why it would be relevant to that reader's life. And so, that's very important. And so if you can find someone who has actually, gone through a study, or who, is impacted by this certain disease, et cetera, and you have all of those elements there saying, here's the story, here's this breakthrough research, here's why it's important, here's how it can make life better for all individuals, and particularly the individuals, the readers you serve. And by the way, I have a patient who's willing to be interviewed. I have a researcher who is ready to be interviewed, and that's everything. I will jump on that and put down whatever else I'm working on a busy day when I'm looking for a story, because that's simple. It has all the elements, and it makes it easy for me.
Thank you, Maudlyne. Yazmin, did you want to add anything?
No, I just agreed that everything here was the same takeaways from a year ago.
Yeah.
I also remember one specific thing that I think it was a journalist at the Crusader mentioned. He just mentioned like be kind, be kind on the phone, and understand that journalists do preliminary research before they do interviews, so that they know a little bit about the subject matter beforehand. So I think this journalist had like negative experiences before that I remember, and that's one thing he said: just be kind.
Yeah. Well, I got to tell you, the document or the material that was shared just before this slide with the pitch and the results, many thanks to Dion McGill at Strengthening Chicago's Youth for making that available to us. For sure, we wanted to leave you all with some examples that were directly related to health research. But as you know, just in communicating any issue or any subject matter, you want to be very intentional about what you're sharing with journalists, that they don't have to do a ton of digging. You know, they can verify what you're sharing, but they don't have to necessarily put all the pieces together for you in sharing your material. So just to run through the bullets briefly, making certain that what you're pitching to journalists, that you're able to communicate the impact on people's lives, the relevance and relatability and actionability, any newsworthiness, clear tie-in to current events or priorities for communities of focus. Novelty, new information, opportunity for exclusive release, visuals, charts, graphs, photos, videos, etc., representative of communities of focus, quotes and contact information for community stakeholders, patients, and researchers who want to be interviewed, clear disaggregated data and information relevant to communities of focus, language translation when applicable, and customization or context for specific outlet or journalists in their audience. All right, any questions before we move forward? All right, so at this time, I want to hand it back over to my colleague, Jen Brown, to lead us in a discussion of what universities and funders can leverage with their power to implement systems level changes. Jen?
Thanks, Jhmira, and thanks everyone for such a great conversation. And we're looking forward to continuing this with you. This has already come up naturally in the call, but we wanted to call it out further, that, you know, the kind of structural and systemic levels that also have to be considered related to this work. So today's session is really about increasing the capacity for researchers and others in health research to know about community media, but that's really only one step toward making health research more accessible. And that throughout the partnership that we've had so far, talking with community stakeholders, patient stakeholders, community media, journalists and outlets, and health research stakeholders, they really expressed multiple types of structural changes within the research enterprise and the media landscape that have to change in order to better support the focus and communication of health research, and ensuring that it's more impactful and actionable to communities and populations most impacted by health inequities. So the kinds of things that people raised is that, one, that what we were talking generally today about health research, but we were in our conversations oftentimes specifically focused on community academic research partnerships. So those that have stakeholders, patients, community members, community organizations, public agencies, healthcare providers involved from the get-go in terms of deciding what is a health issue of importance to be researched, what the research question is, how the research would be designed, and what the research learned, how that can be used for impact. And so really ensuring that research is community engaged and has that community leadership will make these steps of engaging community media easier and more fruitful, because of the wanting to share the relevance, as the community media journalist mentioned. Another piece that came up was that our journalist partners have shared here today is that there's a real need to support community media capacity. That community media outlets and journalists, there isn't a lot of resources for health beats. The fiscal situation for media outlets, especially during the pandemic, has been challenged. And what is the role in health researchers and health research institutions and health institutions investing in community media capacity, with an understanding that that investment is so important for us to be able to have the impact on health. So recognizing that it's not something separate or something different, but that is a core type of resource that should be invested in as a part of research or as part of health work. Another thing that came up throughout the project was the need to increase the representation of historically excluded communities and research faculty and staff, and that the research teams and research institutions are not often reflecting the diverse communities that are most impacted by health inequities in Chicagoland or more broadly. And a need for increasing funding for research dissemination generally, that a lot of research stakeholders and community stakeholders in those partnerships told us that there's not enough of the budget that goes towards supporting their ability to do dissemination related to language translation, doing some of the things that our journalist partners mentioned on a previous slide about how to make the pitch most relevant to them, data visualization, translation, all that kind of thing, that there's not enough support in research budgets to be able to do that. And a lot of our research stakeholders were very honest that currently dissemination is not incentivized adequately within academic systems, that promotion and tenure that require peer-reviewed, that focus primarily on peer-reviewed journal publications. If a researcher, we had one of our researchers tell us, if I have to decide, I have this number of hours to spend, should I write a peer-reviewed journal manuscript draft, or should I work on, a press release or a pitch to a community media journalist? One is going to be recognized by my university and one is not. And so that, that's a pressure, a disincentivization for researchers to invest in this. And so changing how that reward system looks. And also many research stakeholders told us, it's different to write for community media. It's different to know how to put together the pitch that the journalist just asked them to put together. They get lots of training in writing peer-reviewed journal manuscripts. They don't get training about how to, talk with media, pitch with media, work with community stakeholders, to address media, do all the steps of this framework. And so kind of how can the training programs at health and research institutions be changed to provide education about lay, communicating to lay audiences. But even the programs that do focus on media don't often talk about local community media. They're often talking about pitching or responding to things from New York Times or, national media sources, and not often the local community that, again, will lead to addressing some of the health inequities in Chicagoland and other areas. So really thinking about how can health research funders and health research institutions and health institutions invest in this type of capacity and training, and thinking about things like, if your university or health institution has a pilot program, are there ways that you're encouraging or requiring those that you fund to put a certain amount of their budget towards community dissemination or community media dissemination? Are there ways that that your maybe professionals within your university that work with media are building up their own capacity and connections with local community media so they can support research teams and research partnerships in that way? So we wanted to make sure to really stress the types of structural and systemic changes that need to happen in the research enterprise, because we know that all of you are researchers in the, leaders in this field and have different leadership roles where you may be able to uplift not changes only in your own work, but in the structures and systems that we work with. I'll pause before going on to see if folks have ideas about how to advance this further, or comments or questions related to this aspect of the issue as well. Or questions about anything else.
Jen, if I can, while we wait for more questions and comments, just in everything you shared about what universities and funders can do to help maximize health coverage. I think I saw in demonstration in attending the Patient-Centered Outcomes Research Institute, our funder for this project, PCORI, in attending their conference in 2019 in DC. It was really, a beautiful display of diverse stakeholders coming together to solve some of these problems and address some of these challenges. And in doing so, just the same as what you all are doing with CUNY, Yazmin, and thinking about how you can apply that model to Chicago, much like with this project, we came back to Chicago thinking, how can we create that same, warm feeling around health research for community media, and how do we maximize that? And I just have to tell you, like, in leading public narrative, and I get called into different meetings and such, particularly with other educational institutions across the city, there is this deep impression of the beautiful work for this project and what that means for possibly expanding within other institutions. So I see, Jen, we have a comment or a question from Stephanie Torres.
Yeah, thank you, Stephanie, for that question, which is, are there established virtual trainings in Chicago for researchers on how to engage community media? When we began this work and started asking these questions, we didn't find an existing training. So this is the result. This is our first try at trying, at bringing together again, like an amazing panel of folks to speak about this and provide, some of the basic points of directly from them. But we certainly, and you're going to be receiving an evaluation at the end, and you feel free to share it now, but we want to better understand, how helpful has this session been? If we, we're recording this could certainly be shared, but we also want to hear, what would folks like additionally to better support researchers on how to engage community media. And I'll open it up to if anyone else wants to share that's on the panel.
I would like to jump in too. So anything related to trainings or community media, or how community media can help you help us. I just want to throw out again my email. I shared it in the chat, but I can share it again. At SEMA, we do host a lot of trainings where member-to-member trainings, where we have a member who's, let's say good at audience distribution or audience tracking and statistic management. We get them to train other community media outlets on how to do that same thing. But we're also very open to external trainings and other people who are interested in having like a workshop or a community media, like SEMA can host or create something related to that. So Stephanie, I just copy and pasted your question to my colleague at the Reader and said, let's think about this, like how SEMA can perhaps step up to this and see if we can host or, start creating programming for a training where we will have community media members be on a panel, and, anybody who's interested can ask us questions, how we can, help build that gap or that bridge. So yeah, SEMA really tries to advocate for community outlets, whether that be for funding or just for anything related to this sort of topic too. So I'll finish typing out my email here, but feel free to email me and perhaps we can take this conversation off the Zoom, off chat. Thank you.
And Public Narrative has hosted, what we call speed dating events, where we invite journalists and community organizations to come out. Jesús was a part of one just before the pandemic, where we invite folks out to then share and pitch their stories to journalists directly. We also host a series of communications trainings to help groups understand how to pitch the media. So we'll definitely stay in touch and make you all aware of any workshops that we have coming up in the very near future.
Thanks, Jhmira, for sharing this last slide too. You'll see there's the links to the evaluation and some other resources. We'll also put these links in the chat. I wonder, Jhmira, if you could go back one slide too. We have some contact information for, I think these are the Twitter handles for the folks on the panel, as well as the contact for the partnership itself. So we can leave this up for a little bit before going to the next slide. And we really, as Stephanie's question came up, and as the responses you're here, we really want to make sure that that doing this for researchers is supported. As I was saying, let us help you help them. So us having a little bit of time at the end of this session for you to go right now to that evaluation and let us know about what would best be able to do that will be really helpful. And I'm seeing another comment in the thanks Mareva for putting the evaluation in there, and I'm seeing a comment from Kevin Garcia. I think it's important for health researchers and journalists to both feel represented by the other, whether it be with a goal, ethnicity, class, gender, etc. It can help build rapport and incentivize a continuous relationship, especially with community media where there can be less red tape. Yeah. So as folks are looking at that evaluation and the resources, I want to thank everyone that's been here as participants and your questions and your comments throughout. And of course, I want to thank our colleagues at Public Narrative, Jhmira and Mareva. Mareva's behind the scenes, making sure everything works seamlessly, as well as all of our community media journalists. And I want to just give everyone a moment to go around and check in to see if there's any last thoughts, based on the conversation we've had today that you'd like to leave. Who would like to start?
Well, I'm trying to think. Well, I think this whole experience, as being a coordinator for a Chicago Alliance of Media, as I mentioned before, besides trying to collaborate to find steady revenue and to fund community media, I think at least SEMA tries to be an advocate to help answer these sort of questions and to build these bridges. So again, I just want to, thank everyone here for making this happen. And again, just like as I first mentioned in the first few minutes of the call, I think it's really great that there's even a space being created for these conversations to take place. And just an invitation again for anyone who wants to be more connected with community media and wants to, if you all have any other questions or would like to be put in touch with any specific outlets that you would like to do some health advertising or branded content, or just to feel free to get in contact with me and email me. Again, like I said, I work with 69 other local outlets, so I can try to help in any way possible or answer any further questions.
I would just add that in order to address any structural problems, it helps. It doesn't hurt to include people within the system, right? In this case, the healthcare system or the health research system, right? As journalists, our job is to deliver the truth as we can best gather it, right? And the more conversations that take place, the more direct links between journalists and actual and people who have decision-making power. I think the closer we're going to get to addressing the issues that are complex and layered in our city. So I do want to thank those researchers that are willing to have these conversations, that have a desire to really connect with the community. I think if we saw more of that across multiple systems, not just the healthcare system, I think we would be in a different place. So again, I just want to thank you all for inviting me to be a participant, and also for those that want to continue the conversation.
So yeah, I'll just echo everything that my colleagues have said, and just remind you as researchers that we are living in an era of racial reckoning and greater understanding of how race plays of how institutional racism plays in just about every aspect of American society. And not only are we living in a post-George Floyd era, but we're also living in a COVID era where inequities in health is front and center. And so I would just remind you that much of the work that you're doing, it's worth the extra effort to get it disseminated to community media and those of us who cover these Black and Brown communities, because so many of these diseases, so much of your work is impacting diseases that are more prevalent amongst Black and Brown communities. And that's what COVID did. It opened up our eyes to that very fact. And so whether you're talking, the very basic diseases like diabetes and high blood pressure, to more niche diseases like lupus, or, just about every, one that I can think of, there's a higher incidence amongst Black and Brown communities. And much of that is traced back to institutional racism and the lack of access to healthcare, preventative healthcare. So I just leave you with that in order to just stress to you how important it is that you take advantage of the opportunities to use community media and media that reach those communities, because that's where your work is going to make the greatest difference. And you want to make a difference. And these communities need to know. They need the information that you are disseminating, that you are unearthing. They need to know what's coming down the pike. They need to know what has been learned, what the newest information is, the newest preventative medicine is. It's so important if we're ever going to make a difference in American society to a place where everyone can live in, with opportunity for good healthcare and a good life. So that's really what I want to leave you with. And just lastly, to encourage you to reach out to me. My email was there. All of my contact information is there. You can reach me on any of the social platforms. Maudlyne on Twitter, Instagram, Facebook. I am always available to answer your questions, to consult with you. Let's deal with it up front before you end up in my mailbox and I delete it because it doesn't hit home and it's not relevant. So let's work together proactively on the front end. Thank you.
Yeah,
Thank you. And I just want to say that something that we learned through this initiative with the interaction that we have with CIMA, with other media outlets, is the critical importance of collaboration. For media outlets like ourselves, collaboration has been very important in terms of providing better coverage, better content, also in terms of improving our sustainability possibilities. And in terms of health, I think that we need to increase also our collaboration with the researchers, with the physicians, with the experts, with the institutions that are working for the health of our communities. Because Jackie says that community media cannot be objective because we are part of the community and we are seeing as Maudlyne says, the injustice our communities suffer. Then for us, our community media are also a tool for empowerment, a tool for the betterment of our communities. And in that sense, we are aligned with the objectives of health researchers and health institutions that want, of course, to increase health and to try to solve the problems that the communities have in this matter. Then I think we are very compatible to start further collaboration. And collaboration has been, like right now, the gold mine of possibilities for us as media, at least for myself as director of La Raza. And I think initiatives like this and like others that we can start in this in the future could be very, very productive for the common good at the end. Thank you.
Yeah, I also just want to say too, I tell everyone from colleagues to just friends and, just really expand your binder of media. I think a lot of us here are very familiar with the concept of traditional media, which we view as a daily or weekly newspaper. But over my 3 years working with SEMA and getting to know on a personal level the publishers and creators, founders of so many different types of media organizations, expanding your definition of what media is very important, because it touches on a whole different types of like Chicago citizens that aren't typically reported on by mainstream outlets too. So just some to throw out there, like Soapbox Productions and Organizing. They're a new dynamic video producing media outlet that just does the most wonderful coverage of Black and Brown youth in Chicago. So that's an example there. And there's just a lot. So I just recommend checking out our SEMA report from 2021, where we have our full list of 69 members. That's 69 members we have, but there's, I want to say, like at least 100 media outlets that exist in the city that many of us aren't very familiar with or may not know exist. So I just want to say that before we end the call.
Jhmira, anything you want to share before we end?
Sure. So I see that we have a comment or a question in the chat from Carla asking if there are any volunteering opportunities with the organizations, and we can provide that information offline, Carla. Typically, if you look at the website for a particular outlet, there may be different things that they're looking for. I don't know any particular roles within, any individual outlet that might be looking for volunteers, but certainly they would have those opportunities posted on their website, or even perhaps through their social media channels, promoting them from time to time. I do have to say though, in just final thoughts, this was incredible. We knew that it would be very special because of all the hard work that you all put in with us over the last 2 years, but certainly the attendees, the questions you all had, the feedback that you gave, and the wheels that are turning on our end in thinking about how do we continue something like this. And earlier in the presentation, I shared a little bit about our approach to extending this opportunity and really looking through how we can leverage the momentum that was built. But it sounds to me like we've got our own work to do in thinking through, even before receiving additional funding, how more can we maximize this opportunity? So Yazmin, and definitely we'll be getting with you, and certainly the others of you and the outlets that you all work with, definitely will be getting with you all to think about how we can continue this. But researchers, I would just really lean on you to give us a sense of what more you want to see. How else be specific. Think of this is Christmas. Like, what is your wish list? Give us a sense of what you want to see, the type of content we can produce and bring forward to you. Jackie made mention at the very beginning that about gun violence being a public health issue. We've heard those conversations before, but never with the type of data and the relationship with journalists that could really help bring that home. So help us, connect some dots and loop some loose ends in a way that is, not just impactful for your research, but impactful for the communities that are going to receive this through the stories that are published by these journalists and those within our respective networks. Many, many thanks to the brilliant Jen Brown for thinking of inviting Public Narrative into this opportunity. Had Jen not made that call just over 2 years ago, I don't think we'd be sitting here today. So Jen, thank you for your foresight and your vision. And of course, Mareva behind the scenes navigating us through it all, and Dr. Rebecca Johnson for her leadership and guidance through this experience. I appreciate each and every one of you, our task force members that weren't all featured here, and of course are sending good vibes and prayers and thoughts to us. Many, many thanks for all that you all have offered to this partnership. And I look forward to extending our relationships as far as we possibly can.
Fantastic. I love that we're ending as a big old mutual adoration society. Lots of love, even though we had to switch to virtual, lots of love came, and we're excited for everyone that's joined us today, because now you're a part of this circle too, and we really want to address these issues and work on this collectively. So we'll end as we started, which is to say that We all care about health and equity in Chicagoland, and we want research to be a part of that impact. We know that can't be true if research doesn't get to those that can make impact in their own lives or those who hold decision-making positions and in our city, in our metro area. So let's please continue to work together so that we can have the connections that make that happen. We look forward to continue to work with you. I hope everyone has a safe and happy evening.
Thank you.
All right, thanks all.